Carolina is seeing a summer surge in COVID-19 for the 5th straight week. There's been an increase in 3 key metrics health officials still look at: hospitalizations, emergency department visits, and the presence of COVID-19 in wastewater. Doctors say they've noticed a little bump in the numbers each summer since 2020, so this is nothing new. However, they are urging people to keep a few rapid tests on hand just in case they are feeling unwell. Celeste Ford joins us live outside ECU Health Medical Center in Greenville after speaking with doctors and getting reactions from local residents about the rise in COVID cases. Celeste.
Courtney, residents here in the east and all across North Carolina are experiencing what some doctors are calling a summer surge, and they've noticed a trend since the pandemic. Health officials at ECU Health Medical Center in Greenville say over the past few weeks, more patients coming to the hospital for emergencies are also testing positive for the COVID-19 virus. Medical Director of Infection Prevention, Dr. Jacob Pierce, says there has been an increase in levels of respiratory viruses.
We have seen both increases in COVID-19 as well as influenza, which is somewhat unusual for the summer. But I think COVID-19 has really disrupted a lot of our normal seasonal patterns. We have seen since the pandemic began that COVID-19 goes up, comes down, and then tends to go back up again.
Numbers from the State Department of Health and Human Services show there were 239 hospital admissions in the state for COVID-19 since last week. It's a far cry from over 1,600 in January, but the numbers have ticked higher the last few weeks. 56-year-old Scott Thatcher says he made sure to get his vaccines and booster shot after seeing what a friend experienced who chose not to.
One guy I did know got it. He was very sick. I mean, very sick. He didn't go to hospital or anything, but he was barely moving, and he was like that for about 5-6 days.
Factors that raise a person's risk of getting the virus include people who are older, are immunocompromised, have certain disabilities, or have underlying health conditions. Doctors at ECU Health say a person is considered up to date on vaccines after receiving a single dose of the most recent booster shot. 65-year-old Donald Foreman says it was easy to make the decision for he and his loved ones to get all of their COVID-19 immunizations.
I had the first two, so I might as well go ahead and get all of them. So I went, my wife and I decided to go ahead and get them, so we went as a family, got it as a family.
And Dr. Pierce also says patients who test positive during their stay in the hospital are being required to wear a mask until they no longer have symptoms. Reporting live in Greenville, Celeste Ford, WITN News. Courtney?
All right, thanks, Celeste. And Dr. Pierce also says the CDC is expected to release a new COVID-19 booster shot in the next few months.